following segment on Eyewitness News is sponsored by Living Well.
I'm Shay Paul, and I am being joined by Dr. Jared Chapman of Living Well. Dr. Chapman, as always, thank you so much for being with us.
Thank you. We're excited to be here today.
We're excited too. This is really a neat thing that we're doing. Last week we started a journey in the life of a Dr. Jared Chapman patient, and that started with a consultation with our lovely guest here, Heather Ellis, and she talked about some of the features on her face that she was happy with. And you said that you were going to accentuate those features. So we're going to start with that today, right?
That's right.
With the injections? Okay.
We're working on injecting in the mid-face, and basically what we have done prior to you coming on to us is we have cleansed her face with a cleanser and sterilized her skin, and we are ready to begin the injections. Heather has this gorgeous cheek, and we're just going to accentuate that a little bit more laterally and then fill in a little bit of volume that she's lost under the eye.
Okay. Yeah, she does. She has great bone structure. That was one of the first things I noticed about her. I love the square jawline and the high cheekbones. But it can always be better, right?
That's correct, in my opinion. So we're starting with the first injection of Voluma into this area. Voluma is the hyaluronic acid filler that is made by Allergan. It is FDA approved to be used in this area to restore volume. You can see that was a simple little stick. Heather would give us a rating on that of a 1 to 10. Heather, what's the discomfort of that stick?
That was a 1.
Wow.
So each injection that we do, we always do an aspiration to make sure that we're in the correct area to keep her safe. Hyaluronic acid fillers are relatively safe, but we want to make sure that we're not into any vascular structures when we inject. And therefore, we do a little pullback on the syringe to make sure we're not in any vessels. It's a little bit of a safer way to inject. Also being in the proper area, knowing what area you're in. I explained to Heather before we came on the air that she would hear a little bit of snap, crackle, and pop as we injected and feel a little tiny bit of pressure. But other than that, it should be quite comfortable for her to undergo this procedure. And as you can see, she is not even flinching. So what we're doing is we're just giving her a little bit of volume. And what I always talk to patients about and show them is if I lift this area of the cheek, and I don't know if we can see that because we're not able to zoom in and out with our Zoom calls, but what happens is when we lose volume here, we start to see the sag all the way down into this area.
Sure.
And we talked about the nasolabial fold, the marionette. So if we restore volume to this area, we can keep the patient looking very natural and authentic because this is where the volume loss is occurring. This is where the problem is.
Right.
And if we restore this volume here, we will get lift here and here. It's almost like you're taking it and pursing it back up. And you can see that skin lift back up. And then we restore the jawline.
Right.
To be tighter and give that more youthful look.
It's just an added benefit, okay?
Correct. We're also looking to see where the point of light balances on the face. And we want that point of light to balance near to or under the mid-pupillary line so that we create this nice glowing effect on the skin. We also want the chin, the upper lip, and the center of the forehead to become focuses of light when we're looking at what is aesthetically pleasing to the eye on the face. And by doing the injections in this area, we can really change the points of light to be redirected because that's what aging does. Aging is just changing the lights and shadows on our face as the structures begin to change, shrink. The hyaluronic acid and the elastin begins to break down on our skin. As things begin to sag, the lights and shadows, the way the light hits our face and creates shadows, makes us look a little bit older.
Right.
So you can see just by a few simple injections, and I'll have her lift her head up, we're already starting to see a fullness all the way back through here.
It's immediate.
We're
It
starting
really
to
is.
see correction here and here. The little bit of change she had here is already starting to fade away. And just with, I've only injected about half of this so far.
How do you feel, Heather?
It's easy. It's
Sure.
painless. Yeah.
Yeah. And it is,
Go ahead, I'm sorry.
I was just gonna say, it's the instant gratification, really, and I'm sure it only gets, a little better as time goes by.
Absolutely. And the other injection that we're going to focus on is the one that's under the eye here. I'll let Heather lay her head right back there. And I'm just going to put a little tiny stick right here. And most patients do feel this one more than any of the others that they feel. But this is what I call the money shot when I'm doing someone's cheeks and they've noticed a change of volume under the eyes. And when I do this shot here and then I just take that filler, it's one of the safest ways to treat volume loss in the tear trough because I'm really nowhere near the tear trough. And the reason I say that, lift your head now, it's instant.
Oh my gosh, look at that compared to the other eye. Oh my goodness, what a difference.
Within 3 seconds, I was able to restore the volume underneath the eye that she had lost. It looks very natural. She
Wow.
can leave my office. I always say, leave my office, go to Kroger's, do your shopping, and no one's going to know.
Yeah, but don't leave until he does the other side, okay? Please don't, yeah. So that is great, guys. I am looking so forward to next week when we are going to be giving Heather Botox injections, correct? So it's going to complete the transformation there. Not that she really needed a transformation, but as you said, it accentuates what was already a great feature that she
It's
had.
all about accentuating the positive.
Right. All right. So we look forward to next week. Thank you guys for being with us.
Thank you for having us.